The ward was erected in a month's time, and with this addition, the hospital now has 73 beds dedicated to the treatment of COVID-19 patients. 24 of the new ward beds are for the cases still under investigation, meaning for patients who have COVID-related symptoms and for those requiring hospitalization but whose COVID-19 test results are still pending. The rest of the beds are for confirmed COVID-19 patients and patients in ICU who require ventilation and high oxygen flow or intensive and high care. The hospital also acquired a second oxygen generation plant earlier this year in preparation to treat COVID-19 patients. This oxygen plant will support the new ward and enable the hospital to have a steady and suitable supply of oxygen during the pandemic to ensure continuity of care. 16 additional staff members were also recruited and trained to work at the mobile COVID-19 ward for the duration of the pandemic. The Welwitschia Hospital is now effectively operating two separate sections, one dedicated to COVID patients and the other to non-COVID patients. Each section has its own entrance, screening, passages, wards, and staff to ensure world-class infection prevention and control measures to prevent cross-contamination between the two sections.
I think Welwitschia Hospital has really also taken that responsibility and really proactively trying to see how we can assist not only our local community, the Walvis Bay community, but also the rest of the Ronga region, and should it come to it, the rest of Namibia. We do know that our numbers in Walvis Bay have flattened down a bit, but at the same time, we also feel that we would rather be prepared and ready to help and to serve with trusted care in this facility than being maybe caught off guard and not being able to serve, because that is what we would very much like to do for the community of Namibia.
The main purpose of the new mobile COVID-19 ward is to combat the spread of the virus and will be accessible for both medical and for private patients.